Hello everyone, my name is Navneet Kaur and I am Assistant Professor in the School of Health Sciences in the RIMT University Mandi, Gobindgarh. So today I will deliver a lecture on the Integrated Child Development Scheme, that is called ICDS. So exactly what is the ICDS? First of all, it is a program or a scheme which was launched in 1975 in the October month, and this is a very unique early childhood development program. Main aim of this program was to address the malnutrition, health and also the development needs of the young children, adolescent girls, pregnant women and the nursing mothers. So these were the main beneficiaries which were included in this topic. So the primary responsibility for the implementation of the program was with the Department of Women and Child Development, Ministry of Human Resources Development at the center level and at the nodal departments at the state level, which may be social welfare agencies and it may include the rural development agents also. So these were the people who were responsible for the implementation of this program at the different zones. So now we will discuss the beneficiaries. So the term beneficiaries means the people who can take the advantage from this scheme. Number one, it includes the preschool children, that means the age group is between 3 to 6 years, the children in the age group of 3 to 6 years. Next comes the adolescent girls in the 11 to 18 years of age ke bar. Next comes the pregnant and lactating mothers. Next category was women whose age was from 15 to 45 years, or you can say the women in the eligible couple card. Next is the children less than 3 years old and children age group between 3 to 6. So these were the all main categories which can take the advantage from this scheme. Next, we will discuss the which type of services can be availed by the different beneficiary categories. So number one category which we will discuss is pregnant women. So for the pregnant woman, this program or this scheme gives certain services like health checkup for the antenatal mothers. In this, the complete body checkup can be done. Tetanus injection will be given under this scheme, and that means 2 tetanus injections will be administered against the immunization for the tetanus disease. Next, supplementary nutrition. Supplementary nutrition means the woman is taking her own normal nutrition, but in addition we are providing the extra calories and the protein so that the health of the pregnant woman can be in a good way. Next is nutrition and health education. The different education or awareness programs can be conducted, camps can be there, so that we can make the pregnant ladies aware regarding the importance of the nutrition and the health regarding different issues which can be faced by a pregnant woman during the antenatal period. Next comes the nursing mothers. Nursing mother means we can also use the term lactating mothers who are breastfeeding. So for them the same services are there. They are a health checkup, supplementary nutrition and health education. But in supplementary nutrition, the amount of calories and the proteins varies for each category, that we will discuss later. Next comes the woman in the age group of 15 to 45 years. In this, nutrition and health education will be provided. Next beneficiary group is children less than 3 years. So in this, supplementary nutrition will be given. Next, immunization will be done for the 6 preventable vaccine preventable diseases like DPT, BCG, hepatitis, right. Next comes the health checkup for the children, so that if they can assess any major or minor problem, they can be referred to the higher services. So next is referral services, that means they will be referred to the higher centers or the healthcare facilities. Next comes the children in the age group of 3 to 6 years. In this also we provide the supplementary nutrition, non-formal education. Non-formal education means the education which the child get before enrolling into a school. Next comes the referral services, if in case they are just met with any serious problem. Next is the last is adolescent girls between the age of 11 to 18 years. So for them this scheme is having supplementary nutrition services and the nutrition and health education. So that because this age group is more prone to the anemia. So nutritional and health education is given regarding like menstrual hygiene and the different certain foods can be tell them so that their anemia can be prevented. So this was about the services which are given to the different beneficiaries. So now next topic is objective, that what was the main aim, that why we launched this scheme. So number one objective was to improve the nutritional and the health status of the children in the age group of 0 to 6 years, because at that time it was found out that the children were suffering from malnutrition, right. So in order to combat that problem, this scheme was launched. Next objective was to lay the foundations for the proper psychological, physical and social development of the child, so that the proper development of the child will be there in the each and every domain which is affecting the health of a child. Next objective is to reduce the mortality and morbidity. Mortality term is used for the death rate and morbidity for the disease rate. So that means if we will give the better services to the children, their death rate and disease rate can be reduced, and moreover malnutrition can be treated and school dropouts can be reduced. School dropout means that because we are providing the nutrition to the children at the school, so the poor people who cannot afford the proper nutrition for their children, they can send their children to the schools in order so that their child can get a better nutrition. So this was a incentive, or you can a motivation which was given to the poor families so that they can send their children to the schools. Next was to achieve an effective coordination of policy and implementation among the various departments working for the promotion of the child development. As in our country we have different agencies which are working for the welfare of the children. So this scheme was launched so that all these agencies can work in a coordination. Next was to enhance the capability of the mother and nutritional needs of the child, so the proper nutrition and health education. So next is the organization. Organization means which are the different people who are responsible for the implementation of this program at the grassroots level, because earlier we discussed that it is launched by the central level, right? But organization, in that we will read different hierarchies which are working actually on this program. So number one is Anganwadi worker. So the Anganwadi literally means a courtyard or play center. So this is a place where the child can play, right? So this is also called a child care center. This is located within a village or the slum area itself. That means it's in a local locality. So each Anganwadi is run by an Anganwadi worker. Anganwadi is a place. So the person who is working in this area is called Anganwadi worker, who provides the integrated service delivery. The services which we read in the previous slides, all these services are given by the Anganwadi workers. So one Anganwadi worker covers the 1,000 population. That means the area in which there is a population of 1,000, there we have one Anganwadi worker. So this number is same for the rural and the urban areas. But if we talk about the tribal area, so in tribal area one Anganwadi workers covers the population of 700, because in tribal area and hilly areas the houses are scattered, they are not densely located. So in that way they are covering the lesser number of population. The Anganwadi worker provides a package of services, because their function is to provide the services. So we have different type of services, like regarding health, they give the immunization, they are doing the health checkups, referral services are given by them. Next is treatment of the minor illnesses. Second main package is of nutrition. In this they are providing the supplementary nutrition, growth monitoring and the promotion of the health, nutrition and the health education. And for the early childhood care and preschool education to the children of 3 to 6 years. That means for their better development in each and every domain, they are providing a non-formal education to the children. Next Anganwadi worker is a part-time trained voluntary workers. Voluntary worker means they are willing to do this work. We are not appointing anyone by our own will. They are willing for this work, and they receive the incentive of 1,500 per month. And the main function of this Anganwadi worker is to maintain the growth chart of each and every child, and she does the weight of each child under the age of 3 years every month, right? Next, she organizes the non-formal education to the children of the 3 to 6 years age group. Next, she teaches the mothers on health and nutrition. She coordinates with the primary health center staff for the health checkup, immunization and referral to suffering children, so that she keeps in contact with the staff of the primary health center, so that if she finds out any problem with any of the children, so she consults with those staff members in the treatment of those minor illnesses, and if it's a major problem, then she refers the child to the health center. Next comes she provides the treatment of all the minor illnesses. Next is now we are talking about that nutritional services are given to the children, to adolescent girls and to the lactating mothers. So what amount of calories and grams of protein we are giving. So this is different for each and every category. Number one category is child up to 6 years. So for them we are giving 300 kilocalories of energy and the proteins 8 to 10 grams. And in case of adolescent girls, we are providing the 500 kilocalories and proteins 20 to 25 grams. In pregnant and lactating mothers, 500 calories are given and 20 to 25 grams of protein is given. So if we have any malnourished children, so to them Anganwadi workers give the double the daily supplement which we gives to the other children. Just we doubles the amount of calories and proteins, and special nutrients can also be given on the medical recommendation. So this is fixed under this scheme. So this amount, different food will be provided to them which will be containing this much amount of calories and this much amount of proteins. Next, main function, the worker who works above the Anganwadi is Mukhya Sevika. So it's a full-time worker who supervises the work of 20 Anganwadi workers in rural area, 15 Anganwadi workers in urban area and 17 Anganwadi workers in the tribal area. So this ratio differs from area to area. So she visits each Anganwadi center at least once a month. So next higher hierarchy comes a Child Development Project Officer, CDPO. So for one project there is one CDPO which cover a one community development block. That means she covers the population of 80,000 to 1,20,000, and she supervises, coordinates and guides the work of ICDS project as in charge. So she is the main in charge, and she provides the supervision to 4 to 5 Mukhya Sevikas. That means the main function of this person is to supervise the Mukhya Sevikas, which further supervises the Anganwadi workers. So one CDPO is assisted by one assistant. Next is role of health department. So it provides following health services. Number one, health checkups are provided by the services are provided by the health department, because if Anganwadi worker is finding any difficulty in any health checkup, she can easily avail the help from the health department. Number two, handling the referrals from the Anganwadi. The children or the mothers who are referred from the Anganwadi workers, they can be treated in the healthcare departments. Next is immunization is carried out by health workers female, because the Anganwadi worker is just making a list of the children and the pregnant ladies who needs the immunization. So this immunization is carried out by the health workers. Next is health and nutritional education. Proper pamphlets regarding the nutritional health is provided by the health department. So continuing education of ICDS staff. So the main function of the health department staff is to provide the education to the ICDS staff like Anganwadi workers, that how they can assess the health status of the child, how they can diagnose the child that this child is having diseases, how they should check the weight and the height of the child. So this should be taught by the ICDS healthcare staff to the ICDS staff. And the main thing which includes in this education is the treatment of the minor ailments. Next comes the monitoring of the health component of the ICDS, that how they are providing the services. This is monitored by the health department. Next comes the delivery of services. So in this, supplementary nutrition is given to the children below the 6 years and nursing and expectant mothers from low income group. That means the people who are coming in the lower social economic strata. So to them supplementary nutrition is provided. The aim is to supplement the nutritional intake as follows. Number one, each child up to the age of 6 years to get the 300 calories and 8 to 10 grams of protein. Next, each adolescent girl to get the 500 calories and 20 to 25 grams of protein. Each pregnant woman and nursing mother to get 500 calories and 20 to 25 grams of protein. Each malnourished children gets the double of the calories in the previous normal child. That means 600 calories and 16 to 20 grams of protein. So this nutrition should be given for the 300 days in a year. As we know, in a year we have 365 days. So out of those, this should be given for the 300 days. Next is nutrition and health education. So this should be given to all women in the age group of 15 to 45 years, giving priority to the nursing and expectant mothers. So main priority should be given to two categories, that means antenatal pregnant women and the breastfeeding mothers. Next, it is imparted by specially organized courses in village during home visit by Anganwadi workers. That means this education can be given with the help of home visiting. Next is immunization. So, immunization of the children against 6 vaccine preventable diseases including DPT, BCG, hepatitis, right? And along with that we are also giving the immunization to the expectant mothers under this scheme, that is against the tetanus. Health checkup, antenatal care of the expectant mothers. Antenatal checkup is conducted in this. Postnatal care of nursing mother and the care of the newborn infant is included in this scheme. Care of children under the age of 6 years is also done. Besides the immunization of expectant mother, we are also providing the iron and folic acid supplements under this scheme to the pregnant women, and we are also providing the protein supplements so that their protein and iron requirement can be fulfilled. Next is a minimum of 3 physical examinations are done for the antenatal mothers during the whole course of the pregnancy. The healthcare of children under 6 years of age group consists of record of weight and height of child at periodical intervals, watch over the milestones of the child, immunization will be done, and the checkup is done every 3 to 6 months in order to detect any disease or malnutrition. Along with that, treatment of minor diseases like diarrhea, dysentery, respiratory tract infections can be done, or these children can be referred to the hospitals for the better treatment. Deworming, for deworming they provide the albendazole, and prophylaxis against vitamin A deficiency and anemia is also given. Next function comes the non-formal preschool education. This is imparted to the children under the age group of 3 to 6 years, and one Anganwadi center is in a village which is having a population of 1000 people, and the objective is to provide the opportunities to develop desirable attitudes, values and behavior pattern among the children, so that they can learn how to go to a school, they can get the to learn the basic manners and how to sit in a school and how to behave and cooperate with the other children. So, this is the main objective for this non-formal preschool education. Next comes a nutritional program for the adolescent girls. So, all the adolescent girls in the age group of 11 to 18 years receive the following common services. So, number one is watch over the menarche. Basically, the girls get the menarche at the age of 11 to 13 years. So, in that age there are certain pubertal changes in the body. So, main function of the Anganwadi worker is to teach the adolescent girls regarding these symptoms, so that there will be no non-acceptance of the body image in the adolescent girls regarding the changes in the body, so that they can be prepared for the menarche. Next comes the immunization. If like tetanus, immunization can be given to the adolescent girls. Next is the general health checkups once in every 6 months. So, this will be this facility is provided to the adolescent girls in order to check certain diseases and the malnourishment or the anemia deficiency. So, this was all about the services which are given by the ICDS program. Next comes the impact of ICDS. So, in last, what impact this program has given on the population. The result of this program is evident from the certain statistical data, like decrease in the prevalence of malnutrition among the preschool children. After the implementation of this program in the 1975, there was a massive decrease in the prevalence of the cases of the malnutrition. Next, improvement in the nutritional status of the children. It was evident that malnutrition was reduced and nutritional status was improved. Next, improved immunization coverage. The immunization services were availed by the so many people, especially children and the antenatal mothers. Next was a decrease in the IMR. IMR is mortality rate is decreased, specifically infant mortality rate is decreased, because in previous timings, due to the malnutrition, the children in the age group of less than 1 year, they were having a higher mortality rate, that means death rate was very high. So, this was reduced by giving such services. And last was the improvement in the school enrollment. More people were enrolling their children in the schools, and reduction in the school dropout, that means the children were not leaving the school. So, in this topic we just discussed about the introduction of the ICDS program, services given by the ICDS program, and next was the services and beneficiary groups, and along with that the organization of this ICDS program in the different levels, and last was the impact of the ICDS programs on the different parameters. So there are references, you can better read this topic in detail from the J. Kishore book. This is a specific book for the programs, and then mainly includes the national health programs. Next, K. Park Preventive and Social Medicine book, and last is there is a link for this, you can read it from the ICDS format, right. So this was all about my topic. Thanks for listening.